earlier this week on Capitol Hill as they look to make their voices heard, pushing lawmakers to make policy changes. And to talk more about that and what they're calling for is registered nurse Rosa Hart and nurse practitioner Bryanna Patterson. Thanks for being with us.
Thanks for having us.
Thank you, Kalyn.
So this rally that you all had this week was called Shift Change Report for Duty. What message are you and other nurses looking to send with this?
And so we're asking that nurses, use their voices and amplify what they're seeing at the bedside or in their respective places, and asking legislators to support us in, with the legislation that was passed last year. Is kind of how we got going with the grassroots movement to mobilize nurses, to use their voices and to advocate for the populations that we serve and live in.
Yeah, and Nurses Shift Change is not just a rally. We were so glad to get together, but we've been working together as a group over the past year, virtually, writing letters to our legislators, teaching how to submit public comments so that nurses can share their stories and how the policies that are making it through the House or the Senate actually are going to impact people's lives using our lived experience in our profession.
Right, and I want to talk about that. There is some concern that the proposed reforms could make a big impact and leave millions of Americans without coverage. And it sounds like you guys talked to lawmakers about that. How did those conversations go?
And so my meeting went really well. I mean, my congressman is all about nurses, so he is, working at the state level to make sure that people are able to stay, engaged in their care and not have a lapse in insurance and things like that. Yes, they're not able to reverse anything at this point, but they are trying to make sure that people are supported and know their resources within the state to continue their care and not have any interruptions.
And I would like to point out that Bryanna did a great job over the last year helping people learn how to find out who their legislators are and how to set up meetings with them, so they were able to do that after the rally.
I mean, how are these reforms, as you guys are seeing it, impacting you on the ground and how you're able to treat patients?
So for me, from a primary care standpoint, I feel that right now, just making sure that people are up to date on their, screenings and things before the law actually comes into play, and making sure that they have prescriptions and, all of their annual appointments set up until we can get, figure out other ways to support the community. But it's pretty much preventative stuff at this point.
One of the other big concerns that you guys raise is protecting Medicaid and Medicare. So what is at stake if there are some changes made?
That can be anything from individually with people who are individuals who are depending on qualifying for those programs to get their medications refilled or have access to appointments with primary care to keep them out of the hospital or cover their hospital stays, or in the changes in reimbursement, if hospitals are not able to meet their budgets, then we've seen some hospitals start to close, and that affects entire communities and states at large.
And so when you're able to speak with these lawmakers, do you feel like they were receptive to some of the concerns that you all are raising?
Yes, from the feedback that I got, nurses did say that their lawmakers were, receptive of, what we were advocating for in regards to supporting the nursing workforce, planetary justice, increasing access to health care, through primary, preventative, and home care and telemedicine services as well. So I think that we, did make an impact and were able to, get some feedback from the policymakers. But I do think that they know, as far as what is going to be coming down the pike for us in being able to take care of our patients adequately, they are aware of it.
Mm-hmm. I mean, how are you guys looking to strengthen primary and preventative care?
And so, for one, increasing the access, well, not access, but increasing the availability of nurse practitioners to practice independently within their states and not having to have a collaborator as far as like with physicians go. That's one way.
And Rosa, is there anything you want to add on that?
Yeah, definitely. Well, like we were saying about the Medicare and Medicaid access, if it's not affordable for them to take their preventative medications or have their appointments to find out if they're diabetic, then we're not able to prevent those hospitalizations or death or disability. And so it really is the whole picture, right? And so that's what we're trying to address is the trickle down effect of a lot of these bills. A lot of people don't know what they're going to be until they start taking effect. And so I think nurturing a line of communication between lawmakers and nurses is important for a long term in order to make sure that the policies that are written are going to be having their intended consequences and avoiding unintended harm.
Right, and they can hear straight from the horse's mouth on how everything is going, so it's good to have that line of communication always open. I mean, how was it for you guys just being in the D.C. area, being able to be by the Capitol, by the White House, and really make your voices heard on this?
It was really inspiring to be with such a powerhouse group of nurse leaders in person. We've been collaborating, like I said, for like the last year since the last rally, and we were kind of blown away to have so many nurse leaders getting together to do that. So that solidarity was really encouraging, and just to feel like, we got to participate in the process.
Mm-hmm. Absolutely, and I agree. I felt like empowered knowing that I'm not alone in advocating for our community. It was very invigorating, and I felt rejuvenated leaving.
Well, that's awesome. I mean, how was the turnout for you guys? Were you surprised by the group that came?
Yeah, we had a very, very good turnout nationwide. Folks from the West Coast, from Texas, from Virginia, New York, like we were very well represented across the nation.
People flew in from California and Florida, and it was wild to just see how many states were represented. We should probably make a map and put a pin on it for each state that was represented.
Yeah, I mean, what's next for you guys moving forward?
So next, we do have an app that one of our members made that can help streamline when nurses are going to be submitting comments, not necessarily like public comment up on the website, but when there's a bill that's healthcare related that nurses have insights for, to streamline that process of sharing their insights with the legislators who are discussing that bill. That's a really exciting way that we're going to use AI to improve our communication.
Hey, jumping into the AI boom right now, it sounds like. So it's very smart to include technology in all this. Well, we appreciate both of you jumping on, and happy National Nurses Awareness Week to both of you. We appreciate the work that you do.
Thank you, Kalyn.
Much for having us.